To this story now, and Cosatu is joining the chorus of voices calling for Health Minister Motsoaledi to be fired. The Trade Union Federation says the country's healthcare system has deteriorated under his watch. It's urging President Cyril Ramaphosa to remove Motsoaledi with immediate effect. We are now joined on the line from Johannesburg by Cosatu Spokesperson Sizwe Pamla. Sizwe, this is truly extraordinary. It's one thing for a union like the Democratic Nursing Organization of South Africa, DINOSA, to call for the health minister to be fired. It's quite another for you, Cosatu, an equal of the governing ANC, to do so. What's led you to this point?
Well, actually, if you go back last year during our May CEC in 2017, we actually did make this call. This is the decision that was adopted by the CEC at the time, because we were worried, really, when the CEC was doing a diagnosis of the health system. And we were also looking at the fact that government never failed to remind all of us as workers that this is an essential service. And there's one minister who has been in this portfolio on this position for the last 9 years, who even under President Jacob Zuma's administration has never been reshuffled, meaning that there's only one person who has been given ample time to come out with a vision, implement policies, remove bottlenecks, fix whatever is wrong with the system. But as we look now, compare 2009 when he came in to 2018, we feel that he inherited an ailing system, but now he's in charge of a failing system. And we think it's not acceptable. If we still take seriously the issue of Motsoaledi, if we still prioritize people's lives, then it's not that complicated. President Cyril Ramaphosa has said to us, look, I'm coming with a new slate. This is a Tumamina era. This is a new dawn. And we are saying that go and fix the health system. And if you want to fix the health system, start with the minister. Remove the minister who has been there for the last 9 years. We don't think he has any ideas now. All of his ideas have not worked. And we think we need fresh ideas and new faces in that department.
But Sizwe, those are pretty strong words that you use. I mean, you say he inherited an ailing system and now he's in charge of a failing system. Do you not have any sympathy for the kind of arguments the minister presented yesterday about the burden of disease on the health sector, and also about the burden of migration, of more people needing to use the health system that we have? And despite all of that, this health system still, performs in impressive ways in as far as, for instance, the ARV treatment program is concerned. By the end of the next 24 months, I think you said, we will have some 6 million people on the ARV program in the country.
Well, let us look at what is happening with the South African Nursing Council, for example. There is an institution that is in shambles, and unions have been raising this issue with him to say, look, you can't have a South African Nursing Council that only has one office, and nurses in the rural areas end up sitting at home because they cannot renew their permits to practice as nurses. DINOSA, our own affiliate, went to him and offered him office space. They said, we will give you office space in our own provincial offices. All you have to do is to send in your staff people from the South African Nursing Council who will help those rural nurses, so that we can make sure that we remove these bottlenecks that frustrate nurses. He denied, he refused the offer. And still today, we have problems in the South African Nursing Council. Let's go back to 2012, when we adopted a human resource strategy that was adopted by the Department of Health. We have asked to say, tell us, how far have you actually gone in implementing that decision? Because if you are going to complain about the migration and about the system that is overloaded, it's your responsibility to make sure that you do everything that we have promised to make sure that you capacitate and build the capacity of that institution to be able to cope. For us to sit and be told that this situation, it is what it is, and then we're supposed to sit around. No, we refuse. We say, can we then bring in people who will come out with ideas to fix all of these problems that we experience on a daily basis? And also, if you look at all of the problems that have occurred. You can go to the outbreak of listeriosis. The minister never took accountability. You can look at life acid delay. The people at the provincial level were held accountable. We agree, health is a provincial competence. But if the minister felt that his hands were tied, he's had 9 years to come out with proposals and solutions to say, look, government, ANC, this is what I'm putting forward. These are the proposals that I think will help untie my hands so that I'm able to intervene decisively in the mess that is happening at the provincial level. We have seen none of that. We have had we've had no proposals coming from him. So we strongly believe that South Africans are capable of turning around this system. But we cannot, after 9 years, look back with all of the challenges that the health sector is facing and say Minister Motsoaledi is actually the solution to the problems of the health sector.
All right, thank you so much. Pretty strong words there coming from one of the governing ANC's alliance partners, the Congress of South African Trade Unions, calling for President Cyril Ramaphosa to fire the Health Minister, Motsoaledi. That was Sizwe Pamla, who speaks on behalf of Cosatu.